clinical part, the first step, let me select any test patient. Let me see if you have a test profile. Okay,
Okay.
test. So let me select here Amy test. So then, to access the clinical part in the software, we have two options. Or the doctor or the hygienist can open the patient's appointment, and then they can access the clinical part will be all those green buttons at the bottom. The perio, treatment page, progress note, the images x-ray, the lab cases, implant cases, the documents, and the prescription. If the patient doesn't have any appointment yet and they select the patient, as I did here, I type here test, I select Amy, and they want to access the clinical part, I can click here on the top on treatment, and then we will have here the same option I show you from the appointment page.
Okay, so right now I see only three of us names, so I'm not sure if you want to show me on your screen.
Oh my god, I'm sorry. I didn't share my screen, my bad. Can you see my screen now?
Yeah, it's showing now.
Okay,
Okay.
sorry. Let me just start again. So first, we can open the patient's appointment. Here we can access the clinical part by clicking on any of those green buttons, period, treatment, progress note. If not, we can select any patient and we can access the clinical part by clicking here on treatment, and then here we will have the same option that I showed you from the appointment page. So now the first option that we have here is the period chart. Here to create a new periodontal chart, you need to click on the plus icon. And here we have two options for the input method. So the doctor can use the keypad here at the
7,
bottom,
8, 9.
or if they prefer to use their physical computer keyboard, they can click on the hand icon and then select and then click on OK.
3, 1.
If they want to mute the perio, if they don't need to use it with the sound, they can always uncheck this option here and then click on OK. Okay, let me just do this so you can see how this works in the system. Okay, and then when you finish creating the perio, you will need to click on Save. Let me go back. If you need to open a new perio, or I'm sorry, if you need to open existing perio to edit it or just to view it, you can click on the pencil icon, and here you will see you will see here all the perios created before. So you can select any date, click on view and edit, and the system will reopen the existing perio on file. And then of course after that you can continue editing the perio if you need it. Just remember all the time to save it. We have here on the top the trash icon to delete the whole perio. We have the option to lock the perio. This is the option to set the condition, but for the condition we always suggest adding the condition from the treatment page. So let me go here to treatment again. And here in procedure, if you remember the code for the condition, you can type it. Oops. You can type it. If not, you can type here any word that you remember. For example, missing. I select the code, then I click on the tooth, and after that I will click on condition. So what will happen is every time that we add any condition on this page, it's going to be reflected on the period chart as well. Let me show you. So now I'm showing the tooth number 15 as missing. And if I reopen the perio, we will see the letter M for missing tooth. Okay. Then we have the calendar with the pencil icon. This is to backdate the period. As you may notice, when we create the period, the system will assign today's date. But here we can click on the calendar, we can select another date, and then click on update. Then we have the printer icon to print the period with this view. We have the option to email the period to this patient or to another dentist. And this option is called Save to Document. What will happen is when we click on Save to Document, the system will save a copy of the period in Treatment and then Documents. Let me show you. Let me select. Let me click on the blue glasses. And this is the period. Give me 1 second. I think someone wants to join. Okay. Okay, let me come back. So the second option that we have on the treatment is to update the tooth type. So if you have a patient that is a minor, is a child, and you need to update the tooth from permanent tooth to primary tooth, you can click on the tooth icon. And here, if you see the teeth are bigger or are big with the number on the top, you will know this is a permanent teeth or a secondary teeth. So I can click on the tooth I want to change to primary. You may notice that the tooth will become smaller with the letter on the top, so then you know that is a primary tooth. Or I can change all to primary, or I can change all to secondary. And then click on update. The next option is the treatment tab. Here in the treatment tab is where you are going to add all the treatment, the condition, treatment plan, treatment completed. So to add the treatment, we have a few different options. The first option can be, if you remember the ADA code, you can type it here. Let's try with 1206. I select the code, and then I click on TX to add it as treatment plan. If I don't remember the code, that is okay, because I can type here implant, and then the system is going to show me all the procedures using implant. So I select and I click on the X to add it as treatment plan. Okay, if not, I can select the category first. I will select ortho. Then I click on the drop menu next to procedure. And here again, I can select the code I want to add. And one more time, click on the X for treatment plan. If there is any code that you want to add and you know for sure that treatment is completed already, you can add it as completed. So you can click on CP. What I'm trying to say is that you can skip the step as adding a treatment plan. So let's say I want to add a cleaning. Let me select any code. I know this treatment is completed, so I will click right away on complete. So I don't need to add it as treatment plan and then complete it. I just add it as completed right away. If not, if I made a mistake, the treatment is not completed yet, I can always select those treatment with the status C for completed, and I can change it back to treatment plan. Or vice versa, I can select those treatment, and when they are completed, I can click on CP to update the status. Now, when we add the treatment, if you don't mind, let me change it back. When we add the treatment and we decide to present a treatment plan, we are going to select all those treatment. Of course, only the treatment that we want to present to our patient. We can select over each one. And then we are going to click on this printer icon, Print Treatment Plan. This will open the consent or treatment plan. Here your patients can see the office details, office name, their details, their full name, their patient's ID. Here on the right side, if you already add a insurance on their profile, they will see how much the insurance should pay, how much is their portion. Here they will see the treatment list, so all the treatment that you are planning to do. And here you will find a default consent that our system has. This default consent, you can add something else, so you can type additional information, or you can remove the whole consent if you don't want to use it. I can just select, delete it. And if you have different consent for different treatment, you can click on the page, this add recommended treatment. Yes, perfect, you already have. So here you can select the consent that you want to use. Let's try with root canal. I select. I can add more info if I need it. And then I can ask my patients to sign it, or you can sign it. This consent, if you want, you can open it on your computer, you can open it on an iPad, tablet, or the patient can scan the QR code and they can sign it on their phone, and the system will save a copy under documents, here under documents. Or, let me come back to the treatment page. If we decide to email this consent, if we decide to print and give a physical copy to our patient, or we just save the consent after the patient signed, the system will save all the time a copy in documents. So if there is any misunderstanding with the patient, or you need to review what the patients agreed to pay and do, you can select the consent, click on the blue glasses. Oops, sorry. Click on the blue glasses. Yes, because I select. Give me just 1 second. Let me repeat it again. Let me select printer. Let me just save it just to do a quick test. Let me go to the Documents tab. And now if I select and I click on the blue glasses, perfect. So here we have the consent already signed by this patient. Any questions so far before I continue?
No question.
No? Okay, thank you. If there is any treatment that you add, by the way, when the patient sign the consent, you will see here under CST. CST means consent. Those little icons, so you know there is already a treatment plan signed, or a treatment plan already linked to this treatment, that you already save it in documents, or well, the system save it in documents. If there is any treatment that you want to delete, maybe you add it as and you made a mistake, you can always select, click on the trash icon, and you will be able to delete it. If there is any treatment that you want to change the fee for only this patient, because you already have your own fees, meaning when you add the treatment, the system will assign the fee, will do the calculation for the insurance portion, patient's portion. But if you want to apply a discount or to increase the fee for Amy test, you can select the treatment, click on the dollar sign with the pencil, and here you can change the fee. Okay, it's going to be 50, and we will do a discount of $10. And then you can click on update, and here you will see the new insurance portion, patient's portion. We have as well the status existing. Existing means, or you can use existing when the patients come to our office or to your office with the procedure done by someone else. So maybe this patient came with the filling done by another provider, so we can add it. We can click on EX. Yes, I need to select a tooth, my bad. Okay, EX. And then we can add this treatment just for our record. So we know that we didn't do that treatment. It was someone else, another provider in another practice. RF is when you want to refer a patient to someone else. So maybe there are some type of treatment that you don't want to do, or maybe you just don't want to see this patient anymore. You can select the treatment, you can update the status as referrer, and then here if I select that treatment and I click on the orange arrow next to the printer icon, I can refer this patient to someone else. So I can click here, refer to. Let me click on the plus icon to see if you have any contact. Okay, perfect. Let me just select Dr. Alex. Let me save. So here I can select that I want to refer this patient to Dr. Alex. I can type the letter or the reason why I want to refer this patient. And then when I email this letter or I print it or I save it one more time, the system will save a copy under Documents. As you may notice, the system will save here in Documents any treatment plan, any period chart that you export to document, any clinical notes. So everything will be stored here in the Documents tab. Everything will be as PDF, so no one can edit this document. Let me come back to the treatment page. Here on the right side, I notice that you have already some multi-code. Let me just click on MPA. This is new patient adult. And let me click on CP. Remember, CP is the status for complete. So what will happen here? The system is going to add all the treatment that you link to MPA at the same time. So we can see here the system add 1, 2, 3, 4, 5, 6, 7, and 8 treatment at once. So if you want to add more multi-code, as we have already here, so you don't need to add one code at a time, you can go here to Setting, Procedure Code, and under multi-code you can create any multi-code that you want to use. If you need help with this, just let me know, we can do it together. Let me come back to the treatment page. So this is pretty much all about the treatment plan. I will send you by email the meaning of all the status. We have here a few different status, but let me send you by email the meaning of each one, so you don't need to remember right now what means each status in the system. Or at
Yes,
least,
please.
okay. Okay, then we have the progress note. I'm sorry, before I continue. From the treatment page, you can view the X-ray and images by clicking on this tooth icon with the line across, display images. Okay, let me switch to our demo. I will like you to see how this look. Okay. So let me go here to treatment again. So if we want to view the images from this page, I will click on the tooth. Here I can select which image or which X-ray I need to view. And then maybe after I review the X-ray, I can add the treatment or I can plan the next treatment for this patient. So I can type it here, 1206. I add it. And then when I don't need to see the images anymore, I can hide it and I will see the chart again. Then we have the Progress Note tab. To create a new progress note, here is where normally the doctors will create their clinical note. But as well, any staff, only if you want, of course, they can add more other type of note. We have some clients that they add here only clinical note, but we have other clients that they add admin note, general note, and clinical note all together in the same place. So this is more your choice what you want to do. So to create a new clinical note or any type of note, you need to click on the plus. Let me show the chart. You need to click on the plus icon. Here you can type the note. If not, you can have your own template, or each doctor can have their own template. So you can click on Add Recommended Treatment. And here, if you want, you can create, yes, perfect, you have it. You can create different group, you can create the note, you can select the note, and after you select the note, you can add additional information or type something else if you need it. Now here at the bottom, you can select the provider for the note, the assistant, you can sign it, and then just click on Save. Of course, the doctor, before saving the note, they can log the note. But if they forgot to log the note before saving it, they can always select, and then you will see here the option to log the note. So only the staff with access to unlock the note will be able to do it, and then the staff with access can edit the doctor's note. If you need to edit the note, you can click on the pencil icon and then edit the note. Or if you want to log the note, just log it, and then the staff, what they can do, they can add the addendum. To add the addendum without editing the previous note, they can click on this little icon. It's called Click to Add Addendum. And here the staff can add the note and attach it to the previous note, to the previous doctor's note. From this page as well, you can view the photos, x-ray, by clicking on the tooth with the line across. For this patient, we don't have any image, but remember, from here you can select which image you want to view. If you don't need to see the chart, maybe you just want to see only the notes, as the patient may have a lot of notes, you can click on full screen note, and can be easier for you or any staff to read the whole note without opening it. We have the option to export the note to documents. Remember here to documents, so you can select all the note or only one note and export it to documents, save to documents, save. Or we have the option to email it either to the patient or maybe another provider. You can export all the note to Excel, or you can have the option to export all the note to PDF and save it on your computer if you want it. Okay. Then we have the tooth note. Tooth note is when you want to link a note to a specific tooth. So what I can do is I can click on any tooth. Let's try with number 1. I can add the note, and then after I save it, you will see this small green dot or small yellow icon that will appear next to the tooth. So this icon you will see from the treatment page. You will see here next to number 1. You will see from the progress note page. So when you look at the chart, it will be easier for you to know for which tooth you have a note. So you can always come back to the tooth note page, click on the tooth, and then you can read the whole note linked to that specific tooth. Then we have the images tab. Here under images, from here is where you are going to take the x-rays or the photos. To be honest, for your office, I am not sure if you need to click on the twin or the bridge. I can always log to your computer and we can do a test together, just to make sure that
The
everything
twin.
is working. The twin.
The twin. Yes.
Okay. So then the twin will be the middle one. So here, to take a single image, you go to treatment, images, you click on the twin, you take one single image. If you want to use a template such as a full mount template, bite wing, you can click on mount just next to the 3D on the left side. Then click on the plus icon to select the template that you want to use. Okay, perfect. I see that here you have a few. You select, let's try with Clio FMX. Click on OK. And then you can click on the twin to take the x-ray, and the system is going to mount the x-ray on each frame. That, as you can see, you already have an order here for the images. When you finish, then click on save. And that is all. Let me switch quickly to our demo to show you that page. The x-ray, you can send it to this patient by email, or you can print the x-ray. So I can select one x-ray at a time. I can click on the printer icon, and here I can print it, or I can email it to the patient or someone else, can be another dentist. If we want to send all the images at once, I can select, or I can click over each one. You will see the system is adding all to this page, and then I can email all the x-ray together, or I can print all the x-ray together. When you take a x-ray, the system will assign the date by default, but if you want to change the title of the x-ray, you can select, just click on the pencil icon, and here you can change the name, you can change the title of the x-ray. So it can be, I don't know, the tooth number, or another date, the patient's name or patient's ID, whatever you want, to be honest. Then we have the lab cases. Let me come back to your office. Lab cases. To create a new lab in the system, you need to click on the plus icon. Here you will have today's date by default. Here, okay, I see that you already have some labs, so you can select the lab. You can add additional information if you have it, and then just click on save. About the lab, let me go quickly to the calendar, because I wanted to show you that you can link the lab to the appointment. So let me just create a new appointment. Let me double click on the calendar. Let me click on current patient to link Amy test to this appointment. And let me select the provider. Let me put more duration so you can see better on your end. And then from here, if you want to create a new lab for this patient, you can click on the plus icon. Here you will have today's date, but you can select another date, select the lab. Let me select another status so you can see the difference, please. Let me save it. If not, if you want to link the lab that you previously create, you can click on the L with the paper click. Let me select the lab. And then when you finish, just click on save. So now, what can happen is, let me hide the background. So if you link the lab to the appointment, you will see the small LA, the staging next to the blue box. So this can help all the staff to know which patient has a lab case. And depending of the color, you will know what is the status of each lab case. So if you know, okay, the LA is black, I know the status of the lab case is new. If it's green, I know it's already received, if I remember well. So like this, anytime that, let me just come back to treatment lab cases. If I update the status, let me change this to completed. So then anyone that is looking at the calendar will notice that the LA changed from black to blue. So everyone can be on the same page, and everyone will know what is the status, which patient has a lab case, and yes, you can avoid going to treatment lab cases to follow and to check that information for each patient. Then we have the implant cases. Implant cases is a little similar to lab cases. The difference here is that you can add more details. You can link X-ray to the implant cases. You can add more details about the implant. We have a similar status: remove, place, uncover, completed. And you can even link or attach additional documents relating to this implant case. And then save it. Then we have the Documents tab. One more time, here we will have the record of any statement that we send to this patient, any treatment plan that we present to the patient, any clinical note or periodontal chart that we export to document. And as well, if we want to scan, can be the driver license, the insurance card, any additional documents, the EOB, we can click on the plus icon. We can click on the twin. From this page, this will open the scanner of your office. And then we can scan. You select the right category for that document and then click on save. Or if you have the document or the photo on your computer, you can click on the upload button here and then just select the document from your computer or from your device. Again, here you will have all the documents relating to AMI test. And here under practice, you can have just general documents that are not linked to any specific patient. Okay, perfect. I see here that you have the EOB, so this is a good example. Okay, the last tab under treatment and the last option for the clinical part is the prescription. So for the prescription, we allow our clients to either create a paper prescription or submit electronic prescription. For both options, you will need to follow the same step. You need to click on the plus icon, click on select drug, and here is the difference. If you want to print a paper prescription, you need to click all the time on iDS. This is paper. But if you want to submit electronic prescription, you need to click all the time on IRX. Okay, that is the difference. Then you select from the list. You can edit all the days. Can be maybe it's 4. I don't want to affect your database, but you can change that. You select the provider, and then if you sign for the electronic prescription, you can select the pharmacy that this patient wants to use and then click on save. Then, again, if you sign for the service for electronic prescription, the doctor will be able to click on ERX and then the system will open the electronic prescription. You only need to click on issue, and that is all. After that, you will see a green check mark next to ERX, so you know the pharmacy received the prescription. If it's paper and you just want to print it or email it to the patient, you can select, click on the printer icon, and here you can print, you can email it, and that is pretty much all. So this is all about the clinical part. Any question about anything or something else that you want me to show you?
For the prescription, we already activate, right? This is good, right?
For the prescription, well, I do see the ERX here. Well, I don't have the option to do it. I don't have the option. But yes, I do see the ERX here activated. Let me check anyway, because normally you should receive an email from Clover where you need to follow some step. Do you know if you sign for controlled substance or not controlled substance?
Not controlled substance.
Okay.
But I'm not sure if I have any email from Global that you mentioned. So I'm not sure if I have to contact somebody to follow up.
Let me check, and then as soon as we finish this call, I will send you an email if you need to do any other extra step, okay?
Thank you.
You are welcome. Let me just add a note for myself so I don't forget. So smile ERX, not control. Okay, any other question about anything else?
So this one is for the doctor. We have been talking about for the clinical, for the doctor to need to know, right?
Yeah, this is all what the doctors need to know about the software.
Good. Okay. So now we can move on a different subject.
Okay.
Yeah, I want to end up this recording, and then I'll start recording on the for the staff, for the
Okay.
DA in the clinical area that they need to know.